Namaste. I am Dr. Faisal from Kerala, and this is my friend Mr. Arun. So he had a very bad back pain, suffering for last 1 week, severe. Been having it for a couple of months back, I think. So it suddenly increased about 1 week back, and he was in a really bad shape, so couldn't move around. So one of my friends is very close to him, so we asked, why can't we do an endoscopic surgery, which is relatively an easy surgery and very simple. So we thought of doing it on him. Yesterday we operated on him, and I think you should hear the results from him himself. And as of now, we just come for the rounds. So just one day down the line, he's out of bed, moving around, had his regular breakfast, and no ICU, and he was in the room yesterday itself. I think Arun can give us a small feedback on this, how you feel. Tell in your language also, Telugu for Telugu people. Okay? So your friends and all, just the message. Open up.
Hi, my name is Arun. I work for the public sector. I have been suffering for this back pain last almost 4 or 5 years onwards, unknowingly. I thought it's a regular back pain. I keep on sleeping, taking some pills, doing yoga and all, which is not at all been resolved. So I met one of my close friend, Mr. Nitya. So he has suggested Dr. Faisal, who is from Kottayam, from Kerala. Usually most of the people go for Kerala for Ayurvedic, but I approached the scientific doctor. So he has operated surgery yesterday, which I was able to walk after a couple of hours, able to walk, sit myself, and then taken good dinner. Everything is perfectly all right. I really thank to Dr. Faisal sir and his team. That was my honor. Thank you, doctor.
Thank you, Arun, for saying that. Actually, we are actually very happy to see you back in action. So what happened was we had been planning some other treatments, physiotherapy was on, but somehow it suddenly worsened out, and the leg was painful, and when we examined him, you could see that the nerve compression was on L5 root, that is an L4, L5 disc was bulged, and it came out into the L5 nerve root, and it was severely paining, and he couldn't even stand. And it was on the verge of his losing his leg power, so that was a danger sign, and I think he readily owned up. His family was very apprehensive about spine surgery. But to say frankly, I think spine surgery in an open way is little apprehensive for the people. Like they feel fear about it because you give total GA, anesthesia, ICU care, urine tubes and all, so many tubes. It doesn't happen in endoscopy. He was operated under local anesthesia. He was quite awake during surgery. We were talking to him, and he was responding about our questions, and it was a mild anesthesia called MAC, that is monitored anesthesia, and the patient was awake. So it seems very simple to the patient also. It is very relieving to the bystanders, relatives. And Camry Hospital in Bangalore has taken the initiative to launch this procedure in Karnataka. I should say Bangalore.
I thank even Camry Hospital. That was really very good. And we appreciate their efforts, the facilities, nursing team, everyone. It was so good. There is no words to express myself. Yes.
So he's becoming emotional. So he was in bad shape. So really, we find it very happy. So we don't want to waste more of your time. He's getting tomorrow discharged because he's an insured patient. So Sunday is a holiday. So probably tomorrow morning he's getting discharged. And he's supposed to resume his normal office activity within 10 to 12 days. So that's ace of endoscopic spine surgery. And hopefully he'll do well in future. So the rest of the things, I think we'll come back with more videos and update you on these things. So we'll keep you updated. Thank you so much for being with us, and we are with you all the time. So keep your spine healthy. Thanks a lot.